Hello, it's Dr. Rhonda Johnson, and today is Sunday, December 6, 2020. And today I'm going to be talking about the new CDC recommendations for quarantine after exposure to somebody with COVID-19. And I'm going to be talking about self-monitoring if you're in quarantine. But first, CDC changes recommendations on Wednesday, December 2nd. And basically, they moved them from 14 days in quarantine to uh, an option 1 and an option 2, which I'll talk about. But before we go into that, let's just remind ourselves what quarantine is all about. Folks, you go into quarantine when you've been exposed to COVID-19 to help prevent the spread of this deadly, contagious virus. So quarantine basically is used to separate someone who might have been exposed to COVID-19 and who may be developing illness away from other people. In other words, you stay in so that the virus can't get out. Now, the old recommendation was quarantine for 14 days. The new recommendations include some options. So option 1 is self-isolation or quarantine for 10 days. Your quarantine can end at day 10 without testing and if no symptoms have been reported during daily monitoring. So again, you count day 1 as the first day that you go into quarantine. So let's say you have a coworker who calls you on Monday and saying that their COVID test came back positive and they also have symptoms. Well, you've been working closely with this coworker indoors or outdoors, and although you wear a mask, sometimes you eat lunch together, you're less than 6 feet apart, that's significant exposure. So you need to go into quarantine. So you go into quarantine for 10 days, that's option 1. You monitor your symptoms. If you have no symptoms, you end at day 10. Option 2 has to do with getting tested for COVID-19. So if you're able to get tested and your results can come back quickly, you go into quarantine if you've been in contact with somebody who's been exposed to someone with a positive COVID-19 test. But you have to get a COVID-19 test, and it has to come back negative on 48 hours before you end your quarantine. So basically on day 5, you have to get a COVID test, and you need to have your results come back negative before you end your quarantine, and that assumes that you have no symptoms. So if you can't get tested, folks, then stay in isolation for 10 days. Now, what about if you live in a household with other people? What to do with that situation? Well, everybody has to take the steps to avoid spread of infection within the household. So that means everybody will have to wear a mask. You'll have to open up those windows to get that air circulating, get that fresh air in so you can get that potentially infected virus air out. If you have fans, turn them on. If you have a HEPA air filter, use it. And that means you're cleaning and disinfecting. It means also that you try to keep the person who's been exposed, who's in quarantine, in a separate room and using a separate bathroom, if at all possible. Don't do meals together, don't share utensils, and try to, keep everything clean and disinfected. Now, what about monitoring for symptoms for COVID-19? What does that mean? Well, first of all, you need to take your temperature in the morning and the evening. And if you're going to take an oral temperature, always remember, don't eat or drink before you take your temperature. Eat or drink after you take your oral temperature. And then secondly, you want to monitor for symptoms of COVID-19. Now remember, there are 3 distinct phases or stages of COVID-19. And I'll include the reference to a YouTube video that I did in this post. So in phase 1, the virus is replicating in your body. And in early COVID-19, symptoms may resemble a cold or a flu. And that's what you're going to be monitoring for daily. If you feel tired or have a runny nose or a stuffy nose or muscle aches or sore throat or headache or a new cough, a change in the taste of your food, loose stools or diarrhea or loss of appetite, and something really important, a loss of smell. It turns out that a loss of smell is particularly unique to COVID-19 because the early phases of COVID-19 can resemble the cold or the flu. But the one distinguishing feature of COVID-19 in adults seems to be the loss of smell. So, in this pandemic surge, if you're experiencing symptoms that resemble the cold or flu and you're not sure if it's COVID-19, again, you want to talk to your doctor, get tested, of course. But if you lose your sense of smell, assume that you are infected with COVID-19 until proven otherwise and isolate yourself and get arrangements to get tested. So remember, folks, the best COVID-19 infection is the one that never happens. We're in the surge of search, so please be extra careful. Limit your activities, limit your indoor exposure, uh, wear your mask at all times, try to keep your hands clean. And again, if you don't need to do something that's high risk, try to avoid it. And for quarantine, if you are exposed to somebody, basically the new recommendation is 10 days, monitor your symptoms. If you have no symptoms and you can't get tested, do isolation or quarantine for 10 days. If you can get tested 48 hours before you end your quarantine at 7 days, have a negative test result, and no symptoms. If you develop any symptoms, of course, always discuss this with your doctor or your healthcare provider. I hope this has been helpful. This is Dr. Rhonda Johnson. My views are my own. Stay safe, folks, and have a blessed day.